Hello everyone, welcome to Pediatrics by Dr. Anand. This is the beautiful Unacademy NEET PG class where we're going to talk about some amazing part of the second half of our beautiful topic, that is GERD, gastroesophageal reflux disease. So I hope my voice is audible to everyone. Let's quickly finish this topic in exact 30 minutes. More than 30 minutes I will not take the class because then I have to watch a movie. सब लोग आगे 1 second. इज माई वॉइस कमिंग? या इतने लोग क्या है? अच्छा, ये एक बंदा ये जो मैसेज कर रहे थे, बाय हाय हेलो बाय ड्रीम में क्या क्या ओके. इज माई वॉइस कमिंग? नो, या आई थॉट इट्स कमिंग. Yes. So is my voice coming to everyone? Yes. Let's start the beautiful segment. My name is Dr. Anand, and this is the celiac disease part 2. Let me check. It's part 2, no? Yeah, it's part 2 only. I'm just checking. Hmm. Okay, on the beautiful Unacademy NEET PG app, first of all, I hope you guys are giving all the amazing test series happening from April 18th to April 24th. I hope you're giving this amazing anatomy, biochemistry, and all the test series possible because it's gonna boost up your confidence and you'll get very good marks if you work hard. Also, at the same time, on the Unacademy, we have something known as Plus subscription and something known as Iconic subscription. In the Plus subscription, you get amazing access to the live and recorded classes. The educators are really good. The tests and quizzes are of very beautiful, good quality. And you can watch me on your iOS, laptop, and Android devices. This is the Plus subscription. And in the Iconic subscription, you get the Unacademy platform and the Prep Ladder subscription. All the clinical notes, video lectures, question bank, live test quizzes, everything you get on the amazing Iconic subscription. Hello Osama, hello Ekta, hello Dream Girl, so nice to see you. God bless you. Perfect. Let's start the beautiful class. And also we have something known as Unacademy Lite for the NEET PG student. As the exam is just around the corner, we have this very quick and short pack because so that you can revise all the grand tests for the INICT, FMG and UPSC, all the exam oriented questions we're gonna give in this one, Unacademy Lite. Also for the MBBS first year pertaining to next exam, we have this new batch starting from April 20th tomorrow. We have the duration price and the pre-launch price. Basically, enroll if you feel like enrolling. Also at the same time, I'm trying my best to put as many daily practice papers on your Unacademy segments, and I hope you guys are really participating because MCQ is the key. MCQ is the key. And we have a batch from April 6 to May 6, which is going on doubt clarification batch, subject wise, all 19 subjects, and makes you little better for the exams. Congratulations to the beautiful amazing student for the FMG toppers who work so hard and their faces are there. I want Osama, Ekta, and all the amazing people working so hard. I want your names to be there on this beautiful podium. Special class, as you are new to, if you are new to Unacademy, download Unacademy app where we have this amazing special class features where you can download my notes. You never miss the classes because all the lectures are recorded, and you can have a very wonderful interactive live sessions. So I have told you regarding the NEET PG revision batch, which is starting from tomorrow, April 20th, for 1 month, and also the MBBS first year foundation batch, which will fully go for 1 year. Okay, that's it. So boost your medical PG prep with a limited offer of 12, 24 and 36 months. All you have to use is use a code to get a little financial benefit, and the code over here will be Dr. Anand. That's it. That's it. Let's start the class. Plus Iconic and Light subscription, I have told you, with all the beautiful duration and also the prices. Yes, let's start. So we were discussing in the first half of the amazing GERD, which is the most common esophageal disorder, where also we covered that in GERD it is normal in some babies because 50% baby will at least regurgitate once per day. Then also we studied that if you are eating momos a lot, if you are having some spicy food, if you're an obese person, if you're a child who's suffering from some congenital malformations like TEF, if you're a preterm, you can have GERD. If you are suffering from cystic fibrosis, the sweat chloride levels more than 60 millicurrents per liter, if just now we discussed in the evening class. So cystic fibrosis, if you are suffering, you can have GERD. If someone is having cerebral palsy, he or she can suffer because CP patient usually most of the time they are in supine position, and anyone who is in supine position has a very high chance of GERD. Also at the same time, the clinical features: gastroesophageal reflux. So what are the features I'll have? I will have I'll vomit. Okay, so much of vomiting. I'm not gaining weight, I'm not gaining height, I'm feeling heartburn, I'm having hematemesis or hemoptysis, dysphagia or dinophagia, and also a very beautiful sound. I'll be having a this one. stridor, which we have already covered. That's it. And most importantly, one syndrome which is associated with GERD is nothing but Centiford syndrome, where the arcing of the back, spasmodic dystonia, and all those things are there, right? Perfect. Let's now move further. And before starting any amazing segment, we're gonna have this motivating quote. This was the first half which we had covered. Okay, now we're gonna cover the second half of the GERD. Before starting any amazing segment, we always have a motivating quote. And today's motivating quote is: tough times don't define you, they refine you. So tough times don't define you, they refine you. They refine you is something beautiful. They refine you in being a better person. They refine you to be a better version of yourself. Okay, so don't think that, oh, why God have given all the problems to me, I have not done anything bad to anyone, why God is doing. So stop doing all the drama. uh, the more hardships you get, the more immune you become. The more struggle you get, the more immune, the more resistant, the more spark you get, you know. Like anything can come to you, you can face it. It should be like that, and you become a better version of yourself. So it's good. Tough times don't define you, they refine you. Remember that. Hi Pragya, hello everyone. Yes, how do you want to investigate? Can you please? This was the last slide, if I remember, we had covered. I am having gastroesophageal reflux. So, क्या कराओगे मेरा? Which tests do you want to feel? Want to get it done for me? Yes, the best answer is 24 hours pH recording. You will going to get a. You will do a 24 hours pH recording of my tummy. You want to see how much pH my stomach is secreting. Then also we covered that normally this one is the normal pH. Like I'm having food, and how my pH, jumps, becomes more acidic. It's what in general we understand from this graph. This is a 24 hours pH study from 4 p.m. to the whole day, 24 hours. pH study. The upper panel shows this is the normal graph, whereas the lower panel, can you see the pH is going too high once I have food. So that shows my stomach is secreting too much of pH and I'm having little acidic issues, right? That's what. This graph could be a very important question. Remember that. Also, yes, 24 hours, like after this pH monitoring, you can also get 24 hours esophageal manometry. Same thing, only esophageal manometry. That only that this NG tube, this we have inserted in the patient, and this 24 hours, how much pH is basically my stomach is secreting, I will get to know. So what are we seeing? Like in the 24 hours manometry, you are measurement of the esophageal acid exposure. How much my esophagus acid exposure is there? That's what I'm trying to understand in this case, right? Next, now very important question, how it will be done? Like I have not done it, dear. Like usually we put the NG tube in the patient and that NG tube stays for 24 hours. Then I have a reflux, I have a meter over here, pH meter, which basically records my acidic, how much my stomach is secreting the pH. So that machine based, this machine is recording those acidic pH full 24 hours. That's how it is done. But we don't do it in children in general, because this is a pediatric gastroenterologist, the one who does that. Okay. And also, yes, this is a good question. Can anyone please answer that upper GI endoscopy? Is endoscopy helpful in this case? Yes or no? What do you think? The option are yes and the option is no. Take this topic in a very light note. Okay, light. Take it very light. If you are the pediatrician, heartburn, dysphagia or dynophagia, you planned for a 24 hours pH monitoring, I get it, that is the investigation of choice. But मुझे endoscopy कराना चाहिए कि नहीं कराना चाहिए? Should I get an endoscopy done? Yes, you should, because so much of acidic pH I'm throwing to my esophagus. So what will you see? You will see erosions. You will see bleeding in my esophagus. You will see erosions in my esophagus. Okay, have a basic concept. Okay, exactly, true, very true. So beautifully Ansaf is answering. Ansaf, do you come to our special class also? Because I've seen you in all my YouTube classes, but special class I have not. I don't, maybe your ID name is different. And also, what else you gonna see? You're gonna see the break in the distal esophageal mucosa. Can we appreciate this break? Very important, this one. So this is nothing but kind of a break in my distal esophageal mucosa. समझ के पढ़ना everyone, please have a concept, don't cram, general think. Okay, I'm having gastro esophageal reflux, so that way endoscopy will be helpful, because little my esophagus, how much burnt, how much erosions my esophagus has got, I'll get to know. I will see that a distal esophageal mucosa, distal only, no, naturally, because the distal part is connected to the stomach, that's why distal esophagus, how many breaks are there, I will get to know, right? That's what. Yes, perfect. What are the complication? Can anyone tell me, if I am having gastroesophageal reflux disease, what are the complication, what are the damages which can happen to my esophagus? What do you think, anyone? Exactly, exactly. Perfect. So yes, number one, will I have a very importantly stricture esophagus? Yes or no? Very beautiful picture, bro. Can you see that? It could be an exam question. It's a stricture. Why stricture, sir? So much of acidic thing comes from my esophagus. My esophagus starts to become shrunk. My esophagus starts to become shrunk. Number one, I can get a stricture esophagus. And also, what is this condition? This is the normal thing. And here, can you see little bit of kind of stomach contents are going out? What is this one? Now, this one is known as Barrett's esophagus. This is known as Barrett's esophagus. Exactly. Okay, Dr. NKN, that one I don't know, dear. I'll read and let you know. So that's what. So you'll get a stricture esophagus, or you can get little Barrett esophagus. So stricture esophagus and Barrett's esophagus, the regurgitation basically is what as a complication you understand in a case of GERD. And also, what investigation? Anyone? What is this investigation? If this picture comes in the NEET PG paper and I say it's pertaining to some GERD, what will you write? Yes, you will write something known as nuclear scintigraphy. Like, we will not go too much in detail. In general, you should remember that nuclear scintigraphy is also one of the investigation of choice in a case of celiac disease. What do you call nuclear scintigraphy? Nuclear scintigraphy. This is what this word I want you to remember. Okay, perfect. I'm just taking my tablet. Okay, and that's it. What is the treatment of choice? Now, who will tell me what is the treatment of choice? Doctor, I'm taking so much of acidic food and this and that. What is the treatment of choice? Who will tell me? Do you want to do my operation, or what is the first help you will tell the patient? Who will tell me? Anyone? Swaraj? Exactly. The first thing, okay, Hemal says PPI. Before saying PPI, can I write lifestyle modifications? Do you agree with this? Yes or no? Can I write that first of all I should change my lifestyle? If someone is obese, mother asks, what should I do? What should I do? The first thing I tell is lifestyle modification. At least 30 minutes to 45 minutes your child must play outside. TV time should be reduced basically. TV time should be reduced and outdoor time should be more. With 30 to 45 minutes must physical play. Obesity management. Okay, lifestyle modification, right? Exactly. Number one will be this. What is this? The people are sleeping? No. This one is the lifestyle modification. Means number one, after having food, you will not lie down supine. You will not straightly lie down supine. Yes or no? Because lying down in supine position, which basically aggravates the GERD, right? So number one, exactly. So stress free exercise, yes, and propped at 45-degree. Avoid any kind of food. Which kind of food? Any coffee, heavy coffee, and kind of oh, I love this picture. Do you love this picture? What is this? Can you please tell what is this? Oh, chocolate, lovely chocolate, lovely chocolate. This is a nice chocolate. Okay, and what is this? Spicy food. I love pictures. ये तो मोमोज की चटनी लग रही है मेरे को. Exactly. So yes, most importantly, avoid coffee, any heavy drink, avoid chocolates, and avoid spicy food. All those things, Coke, Pepsi, spicy food, you should avoid. Also, yes, there was there was a trial. There was a trial of something. Can anyone tell me? There was a trial of an extensively hydrolyzed protein formula. Very important, because so much the patient is having kind of vomiting, so much the patient is vomiting. So means the baby will be having failure to thrive. The baby will not gain weight, not gain height, decrease in the protein content the baby will have. So to compensate that, there's a trial of the extensively hydrolyzed protein formula diet. That's what is one of the very nice treatment basically. Panchal says Szechuan sauce. हाँ जी पता है. I know Szechuan sauce is very nice. And trial of the extensively hydrolyzed protein formula feed also has shown the treatment. Okay. And what are other things exactly? Can you please tell me any H2 receptor antagonist, and can you please tell me any PPI proton pump inhibitors? Can we have a quick examples of H2 receptor antagonist and proton pump inhibitors? Who will tell me? Anyone? Exactly. H2 receptors antagonists are like Rantac, ranitidine, cimetidine, all those Rantac and all that, right? Exactly. So either I will give H2 receptor antagonist, so much acid is there. Now you give me antacid, it's as simple as that. And you can give me PPI. Name some PPI, anyone? Dr. Swaraj, Priya, Samir, Sushmita, Hemal, Osama, amazing people, rank one people. Exactly. PPI are like, rabeprazole, osmeprazole, lansoprazole, all the prazoles. The question is, which one is the treatment of choice? Nice question. Could you please answer? Which one? Agar if you are the treating doctor, Dr. Osama, if this in busy OPD, you have to diagnose this case. You got a 24 hours pH monitoring done and this and that. What will you prefer? Is H2 receptor antagonist, Rantac and all that, that is better, or you want to give a PPI? Which is better? Exactly. So Samir, Ansaf, and amazing people. Srujana also. Everyone has come to the class. Okay, very proud actually. Very nice. Hmm. Yes, the treatment of choice will be PPI, proton pump inhibitors. Proton pump inhibitors, like lansoprazole, rabeprazole, esomeprazole, all the prazoles basically. These will be the treatment of choice in a case of, like in general, in these cases PPI, right? And the good question. So the class is coming to an end now, and 5 minutes I'll ask you back to back rapid fire for milestones also. How long I should take the treatment if I have a heartburn? Anyone? If I have a heartburn feeling, how long? The options are 1 month, 2 month, 3 month, 4 month. Tell me, if you are the treating doctor, then how long should I take it? Exactly. The answer will be roughly for 1 month. If how long should I take the treatment if I have a heartburn? The answer is only 1 month will be enough. Second question is, how long I should take the treatment if I have endoscopically diagnosed GERD? Very beautiful question. If I have only heartburn case problem, give me only PPI for 1 month. That's enough. Okay. Any rabeprazole, all the prazoles. But if I am properly diagnosed by a doctor and he saw my erosions and break in the distal mucosa and this and that, then कितने महीने मुझे दवाई देनी है? So beautifully answered by Surajna and Sameer and Hemal. Everyone is answering amazing. Very good. So yes, you give me the treatment for 3 months. Every single question is a clinical question, and I want you guys to be amazing doctors in future. Like these all theoretical questions, put them in your practical knowledge, okay? Because if you don't know theory, you are zero in practical. People says don't read theory, you should be good in practical. But practical, how will you see when you don't know theory? So if your patient has come to with only heartburn, give 1 month of treatment. If no doctor, I have been endoscopically diagnosed GERD, then definitely take the treatment for 3 months. It will be good if you take the treatment. And last treatment, कुछ भी करा डॉक्टर बिल्कुल आराम नहीं आ रहा डॉक्टर आई एम नॉट गेटिंग एनी रिलीफ फ्रॉम द PPIs and all that. Do we have any surgical choice over here? Anyone? Side effect of prolonged PPI? No, nothing. Usually the book says there is not much side effect of prolonged PPI. In general, we can take it. So, what is the last surgery? Which surgery? Exactly. With surgery, yes, exactly. Fundoplication, or if you want to have a very hi-fi word, then we have this Nissen fundoplication surgery. The best answer for this one, like I was facing this problem, so you will twist my this whole, kind of the stomach pouch, and you will roll it up. So basically, Nissen fundoplication surgery. So yes, exactly. Sucralfate and all that. Dr. Ekta Tiwari is asking. Yes, in my OPDs also, sometimes I give sucralfate. You can give Digene, but those all things you can give, dear, but you should know in general as a good doctor that PPI will be the good treatment of choice as the book says. Okay, remember that. So Nissen fundoplication surgery, yes, that's very, very important. And where do you do Restili surgery? Restili repair, where do you do Restili repair or Restili surgery? Who will tell me? Nissen fundoplication surgery you do in a case of GERD. And where do you see Restili repair? Anyone? And where do you see Ramstead pyloromyotomy? Ramstead, let me ask you three important surgeries. Ramstead pyloromyotomy. Exactly. Very beautifully. Yes, Swaraj, Surajna. So rest, anyone? Restili repair किसमें करते हैं? उसामा बताएगा. उसामा आगे आ जाओ. और नहीं बताया ना बेटा, देख तेरा मैंने क्या हाल करना है। हाँ जी, एनीवन? Yes, Hemal is right. For CHPS, congenital hypertrophic pyloric stenosis, the surgery of choice is Ramstedt pyloromyotomy. In a case of truncus arteriosus, very beautiful question. Truncus arteriosis, you remember? Yes, in a case of truncus arteriosis, you do Restili repair. In a case of CHPS, you do Ramstedt pyloromyotomy. And in a case of what you call GERD, you do Nissen fundoplication surgery. And in a case of TGA, what surgery do you want to do in a case of TGA? Yes, in a case of TGA, you will do something known as, anyone? Yes, Jetany repair, arterial switch. You do Jetany repair. Perfect. So five surgeries we have learned. Okay, Okay. Perfect. Very good, Priya. Very good, Surajana. Yes. So 7 more minutes, then this class is over. So that's what. So that was all about this class. Let me ask you some amazing questions on milestones. So yes, we have a very quick question. Look at these options. So yeah, 7 more minutes, then this class is over. Exact 11:30 I will finish the class. Hanji, that's Osama is extra answering extra. Jetany repair, DGA, parallel circulation, and duct dependent congenital heart. Yes bro, you remember that, right? Yes buddy, very good. So I'm gonna show you these options. The options are A, B, C, D. Arrange in ascending order. Arrange in ascending order. You have 5 more seconds to look at this question. Arrange in ascending order. कौन सा पहले आता है, कौन सा बाद में आता है? Which one comes first? Which one comes last? So the options are. Let me also think. Do. I know this. मुझे आता है. I know this one. Yes, I'm so happy. Ayo, I already showed you the answer also. Yes, exactly. Priya is already answering. The first thing comes is the D. Nothing but a baby does mouthing. जो देखो मुंह में डाल लेता है, जो भी देखो डॉक्टर साहब मुंह में डाल लेता है. Whatever we give to the child, he puts in the mouth. So mouthing comes by 5 months. Then the next one is C. C is what is C? असेंडिंग ऑर्डर. ओसामा, असेंडिंग ऑर्डर. सबसे पहले कौन सा आएगा, फिर उसके बाद बड़ा बड़ा होता चला जाएगा. सबसे पहले बच्चा माउथिंग करेगा. द फर्स्ट थिंग द बेबी विल डू इज माउथिंग, राइट? Then the baby will have C. C is what is this one? C. Yes, C is nothing but standing with support. Standing with support. कब करता है बच्चा standing with support? Standing with support comes by 9 months, and standing without support comes by 12 months. So first comes mouthing by 5 months. Standing with support comes by 9 months. ये क्या है? Standing without support. Standing without support, and standing without support comes by 12 months. And tricycle, the baby is riding a tricycle. So a baby, tri means 3. Tri means 3. So a baby can ride a tricycle by 3 years. A baby can ride a tricycle by 3 years. So the best answer for this question is nothing but DCAB. DCAB, mouthing, standing with support, standing without support, and tricycle. Has everyone understood this much? Osama is making a tricycle picture also. Very cute, bro. Very cute. So please put a like button to this video, or put a like button overhead. Are you understanding? This is a very crucial milestone question, which if you understand, I assume that you are very good in milestones. Can we move further? Please let me know. Very good. Very good, Dr. Ekta Tiwari. Perfect. Next question. Yeah, I know this one. This is one of my patient, Nishu. Her baby is there. Oh, Anji. So exactly. Oh, Osama, high five answers. Very good. Can you please answer this one? At what age a child can do this? ये कर क्या रहा है बच्चा? पंगे ले रहा है तुमसे? क्या कर रहा है? Yes, very beautiful. What do you think is this one? Yes, exactly. This is nothing but something known as hopping. मोती की तरह है, मोती की तरह आपके पास पूरी पीड्स आपके जहन में होनी चाहिए. Very beautiful like a pearl. Your pediatrics full should be incorporated inside your soul. If midnight 2 o'clock also, if I wake you up and ask you what is this milestone, you should say, sir, this looks like a hopping. And when can a baby do hopping? A baby can do hopping by 4 years. मतलब hopping by 4 years and skipping by 5 years. Tricycle by 3 years. A baby can ride a tricycle by 3 years, hopping by 4 years, and skipping by 5 years. और this also can cause hopping, you can say. और लंगड़ी टांग खेलना, कोई खेला है किसी ने जीवन में? ओसामा, तुमने खेला है लंगड़ी टांग? मैंने खूब खेली है भैया. स्टेपू खेला हुआ मैंने. हैज एनीवन नोज द गेम स्टेपू? या लड़कियां खेलती हैं वैसे बचपन में, हम तो बहुत खेलते थे भाई बचपन में. स्टेपू इज नाइस, लंगड़ी टांग इज वेरी गुड. इन इंग्लिश आई डोंट नो इंग्लिश ऑफ लंगड़ी टांग. ओके, गूगल इट, आई हैव नो आइडिया. सो ट्राईसाइकिल. यस, ओसामा ने भी खेला है. ये कौन सा पिक्चर है स्वराज? बंदर. बंदर बनाया था. हाँ, बंदर की तरह हॉप करना, दैट्स ट्रू. सो tricycle by 3 years, hopping by 4 years, and skipping by 5 years. 2 more minutes, then this class is over. Oh, nice questions. AIMS PG 2016 question. When can a child walk backwards? What do you think, guys? When can a child walk backwards? Do you remember this one? Suraj kह रहा है बहुत खेला है. Good bro, that's good. Bachpan, your childhood should be beautiful, and your adulthood should be thousand times more amazing than childhood. Like don't say, oh, in childhood only we used to enjoy. Yeah, don't do all that. Enjoy the moment. No, it'll be fine. Exactly. So Gandhi ji, yeah. So when can a baby walk backwards? Remember, Priya, no dear, not 4 years. A baby can walk backwards by 2 years. Remember, Priya, a 2-year-old is going to start walking on steps, on the stairs, basically steps or stairs. A baby starts to use the stairs by 2 years. How does he use the stairs? 2 feet at one step. Do you remember this, my dear friends? Yes or no? I am intentionally keeping the classes only for 30 minutes for the YouTube, so that 30 minutes you put all the aura in the class and make the class very wonderful, and you don't even feel sleepy, right? 30 minutes may, if you're feeling sleepy, then you should pray to God, and you should have almonds every day. Okay, if anyone's sleeping 30 minutes, anyone feeling sleepy in 30 minutes. Okay, yeah, a baby start to go on the stairs by 2 years. 2 years पे क्या आता है sir? 2 years a baby should have 2 feet at one step. 2 feet at one step. And imagine that baby is just going to start the stairs. He is walking backwards. Why is he walking backwards? Because there is a ball and baby is going to kick a ball. So can we have three questions and answer is only one? When can a baby kick a ball? The answer is 2 years. When can a baby walk backwards? The answer is 2 years. And when can a baby climb like or put 2 feet at one step? The answer is 2 years, 2 years, 2 years, and 2 years. Did you understand this much? Or should I use some Spanish or Japanese language to impress you? Huh? Exactly. Chalo, thank God. 11:29. One more minute, then this class is over. Tricycle, hopping and skipping. Can anyone please tell me tricycle, hopping and skipping कब आता है? AIMS June 2017 questions. So 3, 4, 5. We have done that. A baby can ride a tricycle by 3 years, hopping by 4 years, skipping by 5 years. And try means 3. Try means 3. So a baby can ride a tricycle by 3 years. Perfect. Early adolescent age, anyone? Recent question 2017. Early adolescent period is which age group do we say? Can anyone please tell me? Osama bro, jaldi answer karo. Exactly. A baby, no, early adolescent period comes by 10 to 13 years of life. 10 से 13 साल को हम कहते हैं early adolescent period. Perfect. Last question. 11:30, the class is over. Last question. Handedness. I am a left-handed. I am a right-handed. So handedness comes by how many years? Photographic memory, guys. In all my lectures and classes, pay attention to the pictures. My only in my whole life I've only learned through pictures, 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 real patient scenarios, pictures, videos, pictures, videos. No theory, only pictures. So can I see this very beautiful picture where the baby is writing something with the left hand? So handedness, I am a right-handed or I am a left-handed. So the answer is 3 years. Handedness fully establishes by 3 years. Actually Nelson says 4 years, but we'll only stick to the OP ghai, and the PG question booklets also says 3 years only. So I am Rahul, I am a boy, I am a 3 years old. So can we have three questions? Question number 1. Handedness comes by how many years? The answer is 3 years. When can a baby make a circle? A baby can make a circle by 3 years. And or kya tha? Yes. When can a baby knows his full name, age and sex? When can a baby knows his full name, age and sex? The answer is 3 years. Remember that I am Rahul, I am a boy, I am a 3 years old. Please, beautiful, with a lot of beautiful efforts, we have covered some amazing milestones. And the last question, yeah, this is a cute one. This girl is like, really? So really? When can a child ask questions, anyone? Exactly. Okay. Oh, that's beautiful. Osama is, very beautiful. Osama says that he can write from right hand also, and he can write from left hand also. What do you call this condition? Who is both handed, right handed also, and left handed also? And very less people, very few percentage in the whole planet, people are, right handed as well as left handed. So I think that's a God gift, Osama, which you have. So anyone, when can a child ask questions? Like really? Photographic memory, remember dear, Yes, a baby, yeah, exactly. Ambidextrous, yes, exactly. Ambidextrous. And when does bidextrous comes? Bidextrous is nothing but holding something with both the hands. Bidextrous approach comes by 4 months, and unidextrous holding something with only one hand, it comes by 6 months. So holding something with both the hands known as bidextrous comes by 4 months. Holding something with one hand known as unidextrous comes by 6 months. And when can a baby ask questions? The child can ask questions by 3 years, and he can ask meaning of words by 5 years. किसी तरह अपने दिमाग के सलका दायरे में ये बात बिठा दो. A child can ask questions. Okay, really, she's asking question. Really, so a child can. It's very cute actually. So a child can ask questions by 3 years, only the questions, and ask meaning of words. ठीक है, meaning of words by 5 years. That finishes this class today. Thank you so much everyone for this participation. And remember always, the before leaving, the motivating quote is, life is not a rehearsal. Life is not a rehearsal. Make the seconds count. Make your life count. Make the moments count. Make every single second of your life count. Okay, don't blame on others. Just enjoy life, whatever comes, just go with the flow. And I think it's gonna be a beautiful journey if you take things in a very positive way than jumping and or doing that way. It's better to just chill out, and it will make more sense by the end of the journey. So life is not a rehearsal. Make the seconds count. Tomorrow we're gonna have a class. Tomorrow I have a class with Dr. Cheshta, a beautiful dermatologist. I mean, beautiful in a way. She's a beautiful person by beautiful knowledge. Dr. Cheshta, I have tomorrow 8:30 p.m. I have a very amazing special class with her, and day after tomorrow also 8:30 p.m. So these 2 days, guys, please keep yourself free. We have part 1 tomorrow and then part 2 tomorrow. A special class 8:30 p.m. with Dr. Cheshta, where I'm gonna discuss some amazing top 50 pediatric dermatology images and slides like measles, mumps, erythema toxicum, Mongolian spot. So we're gonna cover some crazy stuff, and it's gonna be amazing. Tomorrow evening 8:30 p.m. and day after tomorrow evening 8:30 p.m. with Dr. Cheshta, pediatric dermatology, top 50 top liners and top class pictures of the whole respiratory, cardio, parabdomen, and infectious disease. Thank you so much. It was a quick 30 minutes. I hope you had a time. I hope you had a great time. Not I hope you had time. I hope you had a great time, and good night. Take care and see you soon tomorrow. Okay. And before sleeping, check out my other classes. Okay. YouTube session also I'll keep. सोने से पहले देख लेना मैंने कितने बजे रखा है. ठीक है. Bye bye. Take care.